Omni is home to a variety of locally produced current affairs programs and daily national newscasts, broadcast in 6 languages. To learn more about Omni Scholarships, visit omnitv.ca/scholarships.
This is Rogers TV, Grey County.
Hello and welcome to the special edition COVID-19 Rogers television program. My name is Carol Merton, and today I'm delighted to welcome as a guest Dr. Arra, who is here to provide us an update on COVID-19 and all of the different variants that are out there. Dr. Arra is the Chief Executive Officer as well as the Medical Officer of Health for the Public Health Unit Grey Bruce. Dr. Arra, thank you for joining us today. It is nice to see you, but I'm really looking forward to having other topics of conversation than COVID with you in the future. So where do we begin? I'm curious about the status in Grey Bruce as far as trends and how you think we're doing generally as we're moving through this endemic, whatever it's called now.
Thank you, Carol, for having me. It's always a pleasure to be here, and it's great to talk to you.
Thank you.
It's still a pandemic. The pandemic is a designation or a decision by World Health Organization, and usually it moves to an endemic at a certain point, but locally we're not in emergency anymore based on the declaration of emergency and the emergency over by the counties and the municipalities in Grey and Bruce, which is great, which is consistent with the trends that we've been seeing. We've seen the Omicron wave peaking early January and steadily decreasing, whether it's the number of cases, number of outbreaks, number of hospitalized people, and complexity of outbreaks. All of it is reassuring. With the lifting of restrictions, it's expected to see some increase in transmission of the virus, whether locally or provincially. Nevertheless, we never look at data from a few days. It has to be a trend, and all in all, we are on the tail end of this pandemic, the way I see it. And again, this pandemic has been humbling. There could be other variants. There could be waning immunity to vaccine. Regardless of all these scenarios, I do believe in Grey Bruce during the different junctures, the community, the partners, the establishment, all of us have proven that we are efficient and able to collaborate to address the need. And all in all, if there is a new variant that's going to change severity or be more severe, that's highly unlikely. But if we are in that scenario, I have full confidence that people will do their best to address it at that time. So
just to, we are lifting restrictions. And there are people who are still hesitant. They know that the permissions to take off masks and increase gathering sizes are there, but they're nervous. And what would you say to the general public around that?
Well, it's definitely a time that is going to have different groups of people with different level of concern and anxiety. We need to address one aspect of it before we go into the general. For individuals who have certain medical conditions or immunocompromised system, they need to follow their healthcare providers' advice, which could be way more stringent than the restrictions that were implemented. And they need to ensure their safety and the safety of their family. In general, at this time in the pandemic, we need to be intentional about the fact that, yes, we've been engaged and concerned about the pandemic, and we addressed it, and we need to move slowly but surely with the regular data that we're receiving that's reassuring to a stage where there's no emergency and there is return to modified normalcy and hopefully normalcy. At this point in Grey Bruce, wearing masks in public is not mandated, and that's part of the provincial lifting of restrictions. People can still wear masks if they find themselves in a very crowded situation where they're not part of their household, whether it is carpooling or spending some time close to a colleague to look at the same computer. It would be warranted, and sometimes wearing a mask could be for the purpose of putting other people at ease. Mm-hmm. I personally would wear it if I feel somebody's having any level of anxiety about it. I'll be supportive of them, and there could be reasons, medical reasons, or just simple anxiety reasons.
Yes,
which is a valid reason to support other people through this. Going forward, it is important though to realize that the level of concern and risk that required mandating masks or mandating these restrictions is decreasing. And hopefully we're going to go back to normalcy at some point.
Mm-hmm. So a couple things. What you're really describing is, I sort of have the phrase mask courtesy, where, there seems to be a change in attitude in that, for example, I've attended meetings where some people will choose to wear a mask and others don't. But when people come closer to someone wearing a mask, they say, "Are you comfortable if I stand and talk to you, or do you want me to put a mask on?" 2 years ago, I don't think we would even thought to have asked that. I mean, it's a new question. It's a new approach to wearing masks or not. And out and about, people seem to still, for the most part, want to wear their masks, which I found interesting. You'd think there would be a massive mask flinging off, but people are still, a certain percentage, wearing masks in grocery stores or, and that's quite interesting to observe, where, they seem to want to have that sense of security for a bit longer as well, which is very interesting. So you're indicating we may see an increased trend in the next few weeks, possibly, with COVID, but it doesn't mean because we're not wearing masks anymore, correct?
Correct. We've seen the data fluctuate in different parts of the province for different reasons. The weather is a very strong indicator. There is seasonality to these viruses and the way they transmit. We had a few weeks or a couple of weeks of warm weather. Now it's a bit colder. That can change things where people spend more time doing indoors. Going forward, obviously, the season is going to be warmer and warmer. We're going to go into the summer. So from that point of view, it is reassuring. We know that the mRNA vaccines have a window of time of higher efficacy than waning of immunity. So that can be a variable that later in the summer or in the fall we have to deal with. There could be another surge. Regardless of all these variability, I don't see it coming to the degree of emergency. We have the capacity, the public is aware, and people know what we need to do. And if we need mass immunization, we've proven in Grey Bruce in January, we provided access to half the population or the entire eligible population for a third dose. And we reached half the population in a short period of time. So all in all, yes, we are seeing actually in the provincial data some increase, but it would not change the conclusion that we are still at the tail end of it.
So there is a possibility that a fourth dose may be offered in the future, or is already being offered to certain groups of the vaccine, correct?
That's correct. We are preparing throughout the province for another immunization campaign in the fall, if the need be, whether it's a different variant or the waning immunity or the colder weather. But again, all these things are not different from what we usually plan for other diseases, whether it's a seasonal influenza or other things.
Agreed. Yeah. So it sounds to me as if the Health Unit will continue the important role of monitoring and making a pivot to adjust based on what the statistics are showing. That's a critical role for the public health unit in protecting the public. The resources that you required for all of the COVID strategies, the hubs, the immunization hubs, gradually people are resuming their portfolios. Is that correct in the health unit at this point?
Definitely. We started planning for it actually last summer before the Delta variant arrived, and we started proceeding with it after we managed that wave. With Omicron, we put it on hold, but now we are proceeding to the recovery phase and addressing other programs, ramping them up. So going forward, Carol, there is a balance between two things. Continuing monitoring of COVID and responding if there is a need for a surge, or responding continuously with the baseline cases that we have. And there is a component of vaccine in that response as well. And on the other hand, we have a ramping up of the other programs and recovery. And there is a list of services that the health unit provide, whether it is the other immunization other than COVID, or the dental health for seniors and for children, vision screening, school programs. We have an array of good services that we provide there. And we recently actually presented to our board, and we got the approval on the strategic directions. And we have in our plan, the plan for 1 year, 0 to 1 year, then 0 to 3 years. And we had before that, and continue to have the 0 to 15 years, which is the Center of Excellence for Rural Public Health. And it's a Northern Star metric. It's a technical term in the management where you would have a Northern Star to aim for. And all the changes that are going to happen during the coming years, whether intentional or changes that would come from external variables, budget, or from the ministry, or the mandate of public health. If we can focus on that center of excellence, we make all the changes more meaningful when they come. So to that end, one of the things that we pivoted for in the coming year, 0 to 1 year, is potential of having newcomers from Ukraine. And public health supports the settlement of refugees in many programs. And again, that, 2 months ago, that was not on the radar at all altogether. And now it is part of our strategic plan to hopefully serve the newcomers when they arrive.
And that's important. And just to go further on that way. So when you develop your strategic plan, you link with other partners in the community around that too. So that particular strategic plan, who else might be linking with the health unit to work on that as part of an initiative?
One example is the main strategic plan in the coming 3 years is the mental health and substance use, to take the momentum that we had during the pandemic of leading the emergency and mobilizing the community and working with partners to take that momentum and address the emergency that we were dealing with before the opioid crisis. So on that front, you would have a wide spectrum of partners who work on that, whether it's the healthcare system, the municipalities, schools, police, EMS. So in our regular business, we look at the epidemiology and the statistics in the area, and we support all these partners, but at the same time, we know what parts are more meaningful to be addressed or more needing of collaboration. One example is the Hanover roaming home outbreak. That was a really good example of we were not just managing an outbreak, we were managing the support of the least advantaged people who have housing challenge or substance use challenge, and ensuring that their isolation is safe from point of view of withdrawal from substance or overdose. So the paramedics in Grey Bruce have been instrumental in that. The healthcare system, primary care, the municipality, all these partners came together. And again, that really translated into framework that we have been replicating. And actually, we got calls from other parts of the province, 3 or 4 health units, wanting to use the same framework whenever their shelters are affected. And it became part of our strategic plan going forward to be addressed, hopefully, over the coming 3 years.
I'll probably, because you may not say this, but I'd like to congratulate you because there's been some very significant initiatives that Grey Bruce Health Unit has been involved in, and certainly you in your role. The immunization, the hub, the 3 W's came from Grey Bruce, right? But in addition, you're mentioning the approach to the rooming house. Since that, and correct me if I'm wrong, we now have a mobile outreach program, the SOS, that has modeled after taking the care services to the community as a result of that rooming house learnings, which I think will benefit many communities, not necessarily in outbreak situations, but just to reach those who are most in need of those services. And I think at the end of all of this, I truly hope that there will be some acknowledgement and demonstration of the initiatives that Grey Bruce Health Unit has pioneered, as well as all your community partners. Because as we're going through the pandemic, you just kind of go from one thing to the other. But there's been significant advancements and approach because of our strong partnering culture, I think. So just to put that little bug in your ear, Dr. Arra. It's not a virus, it's just a little bug in the ear.
Thank you so much. I am honored, but truly it's there is a level of collaboration in the communities in Grey Bruce that I haven't seen in other places that I worked, and that was attractive actually to me being in this area and choosing the job, and we're glad to be of service. Yeah. We're glad to be of service. Thank you.
So I'd like to just go back to the COVID for a moment, and then I would very much appreciate discussing some of the issues that have come as a result of the isolation and just the mental stresses that are creating health challenges in the future for people, including the opioid situation, if you don't mind, and what public health is doing around that. I have a concern that with COVID, some of the terminology that's being used to describe the new variant that is possible is not helpful. It's not your term, but words like stealth virus. It just makes people apprehensive and fearful after 2 years of living with this. Where do those terms come from?
It's the first time I heard about that. I should say the mass courtesy is a term obviously you might have created, but I'm going to be using it. The term about the virus. I don't follow social media. Obviously, it's out there. There is a team who follows social media and takes the best and what needs to be addressed in it. We all need to be careful that there is a hardship with the pandemic, and that has been 2 years that is emotionally taxing on many people, financially taxing, yeah. and the terms that people use can affect other people in many ways other than creating a new term and using it. I know the science of the evolution of the virus, and it has proven consistent throughout the pandemic, except for the Delta variant. It was more transmissible, but also more severe. The general rule is more transmissible virus that is less severe and less severe. And we know COVID-19 is part of the corona family, also known to humans as common cold. So the virus, regardless of the name of it or the term, as emergency, it has been declared over locally and hopefully provincially soon, and we go forward and the pandemic is going to be behind us. How can we focus to be united as one society instead of people who received vaccine versus not, travelers versus not, people who who use substance or not. We are one community, and we need to do our best to ensure that our children grow up in a world that is better than the one that we inherited.
And certainly those are important words, because we have seen a lot of potential conflict and friction and interpersonal relationships that have been challenged, and we need to move forward and somehow build bridges to better health. I think that's critical for sure. Speaking of vaccines, so have people fallen behind with their vaccination schedules for other? I mean, public health does a lot of vaccinations of different things. The clinics are starting to open, and people, are we behind at this point, or are you feeling confident that people will come and get the vaccinations they need?
Yeah, so there is a backlog. It's not because people are hesitant, just because the programs were not operating. For example, primary care used to provide the service and open for everybody, and during the pandemic there was shutdown, and people might be reluctant to visit the healthcare system. The schools, we focused only on the educational part and the COVID vaccine. Now, obviously, there's the need to go back and catch up on the other vaccines that have not been provided, whether it's hepatitis B or human papillomavirus vaccine. These vaccines in general in Grey Bruce were above provincial average, and across the province we've seen them dip down. There is definitely that's in the plan 0 to 1 year strategic plan for Grey Bruce to catch up on these vaccines, and we have the capacity, we have the partnership with primary care, and I have no doubt we will catch up on those within months.
Excellent. I also noticed, I'll put it up, but the needle syringe program is open. So I wondered if you could speak a little bit about that. That's a reopening of the GB Works needle syringe program site that was closed.
Yeah, the harm reduction programs, we have a number of programs. The core programs continued throughout the pandemic. We didn't stop them. But there's always something else to do. You can provide we have 17 sites across Grey Bruce, and the plan was to expand them to 20 or 30. And obviously we didn't do that fully during the pandemic, but the core programs were available. Now we're going back to that outreach and working with partners to address it. And it's not just the needle exchange program. That program is a gateway to go to housing. People who are struggling with substance use, when they have the trust into the healthcare provider, that door will open to finding housing or connecting them with other services that is most needed.
Yeah. The expression "no wrong door," and it allows doors to open through that program. There is I'm told, an opioid and overdose crisis in our community, throughout Grey Bruce. Would you agree with that statement?
It is across the country, across the province, and we definitely have it's an emergency. You look at how many lives it claimed. It's not different from COVID.
Yeah. So the public health unit role around this emergency, can you clarify as we move forward how public health will be working with the other organizations and agencies around this? People are concerned. It's affecting more and more people, and sometimes people come across, unfortunately, overdose victims who have succumbed, and that's a lasting impact for sure.
Carol, you made my week by asking that question. We have a central role in public health to actually mobilize the community to hopefully address this, and I have no doubt in my mind, I have no reason to believe it wouldn't work. We can create a model that can address this issue in different ways, and we do this continuously in public health. We have the epidemiology and the statistics to look at what's happening in the community. Is it related to the geography? Is it related to age group? Is it related to family situation, whether it's single parent family or so? And that's the engine for making decisions. Then you have different doors, like you rightly said, to actually engage the public or engage people who need. And we start from age 0 and before. We have the Healthy Baby, Healthy Children. We identify families in need who are women who are pregnant and have higher risk of complications to pregnancy or potential mental health issues, whether it's for the mother or for the children down the road after birth. We have screening for all live birth. Any person who gives birth in Grey Bruce, we screen whether the family is high risk or not, and if they're high risk, we do a thorough assessment, how we can support and connect them with other services in the community, and how we can provide them with the education and the resources to have early childhood development. And Carol, the period of time between 1 to 5 years is really essential in the trajectory of health of the individual and their ability to socialize. And kids, when they socialize, they grow up to be part of a team or a sport, or they might fail to socialize and they end up excluded, and that really creates the emotion or the trajectory to many things that are harmful for the child or for the community down the road when they're adults. So that program is key. In the school, we have multiple programs about mental health, about substance use. We have programs across lifespan, and we will be very intentional, as it is part of our strategic direction over the coming years, to engage the partners and be, again, intentional, purposeful in addressing this emergency. And hopefully we can create something like we did before during the pandemic, where other parts of the province and the world can benefit from.
What I'm hearing you say is we may be moving through COVID, but the important work of the public health unit has not stopped. And the focus is definitely on health and healthy communities as well. We have a minute left in the program. The last words are yours.
Well, I just want to thank everybody who invested effort during the pandemic, and it's the majority of people in Grey Bruce, whether it's the public or the partners, the healthcare system, private businesses, small businesses. The media has done a bang-up job. Like Carol, your work right now and over the past 2 years had saved lives. I have no doubt in my mind when the media, when journalism puts the information in a timely fashion in the hands of the public so they can make their own decisions, informed decision, and protect themselves and their family. Local political leaders and the establishment in general, like everybody, have done amazing work. Long-term care, I cannot thank them enough for what they've done. So that's all I wanted to say. Thank you so much for everything that you've done, Grey Bruce.
Thank you so much, Dr. Arra, and I'm going to give a kudos to the producer, Mark Perry. He was the one who made all of this happen, made sure that we connected with guests, and I could not do this without him. Thank you for being on the program, and I hope you will come back and talk about other things than COVID-19. Thank you so much to the viewing audience as well for joining us today. Please join us again to learn more about programs and services available to you and to your family. Take care and stay safe. Thank you.
This program is brought to you by OHL Action Pack. Looking to see tomorrow's stars today? Follow the teams and players you want to watch. OHL Action Pack is part of the Rogers Super Sports Pack.
Call the Rogers TV viewer response line, email us, or connect with us on social media.